we thank you for joining us and open it up for questions for those that have more questions or comments that they would like to ask. I tried to answer quite a few questions in the chat, but happy to entertain questions if someone wants to unmute or has something that they want to throw in the chat before you go.
So I've had genetic testing done, I've had chromogenic testing done, and all of my testing shows 2 bleeding disorders, but the HCC still only wants to treat one of them.
So you said the testing shows 2 bleeding disorders,
Yeah.
but so far you're only getting treatment one of the bleeding disorders. Yeah, so that's interesting. I mean, part of the trick for that is that you know, like I'm going to use myself as an example, right? So like I absolutely have a bleeding disorder. You know, my family history confirms it. How genetics works confirms it. I have a genetic test that confirms it. And I have factor levels that confirm it. Thankfully, in my personal experience, I'm not particularly symptomatic, right? I do have some symptoms, right? Like I definitely bruise more easily. And there's been a couple of times in my life where I have been able to access treatment in a like prophylactic kind of way. Yeah. And I don't know if I would have had a more severe situation. The reason I say that is because you could have a bleeding disorder and that you could have 2 bleeding disorders and they may just not know which of the 2 are causing your symptoms, right?
Yeah.
So you're gonna just document as much as you can,
yeah,
and do your best to work collaboratively with those physicians. And I mean, ultimately, if you're still struggling and you think, gosh, I'm still experiencing too many symptoms, you know, you may have to look at, I mean, we're lucky in California, we have many excellent treatment centers here. You know, it may be at some point a time to say like, hey, I'd like to get a second opinion on this.
Yeah, like I've pretty much
that second opinion.
Like, yeah, I've pretty much been directed to the conclusion that I'm probably going to have to go down south and seek out the centers down there, which I have the HCC, so it's pretty much taken anywhere as an HCC.
And I will also say this. I will also say, you know, sometimes you want to do it in a respectful way, right? You want to be able to work collaboratively with those physicians. And I also know people who have stories where they got another set of eyes on it. They got a good treatment protocol in place. And then they were able to go back to the original treatment center that is closer to their home. And because they had like an addition, you know, they were able to then consult with a different center. And that brought a better conclusion to the situation. So just because you go and get a second opinion from somewhere else doesn't mean that you won't ultimately be able to get care at the location that's closest to your home too. So, I mean, yeah, happy to, if you have further follow-up that you want to do offline without that, my email address and phone number are like up there on the slide. Feel free to take that down and reach out to me individually if we can, you know, explore the specific options, you know, further. There was also
I'm like, you said it's on the slide. I'm blind.
Oh, it's on the very bottom of the slide, but I'll put it in the chat too, just in case that's easier to cut and paste. Maybe it's not showing up very well on there. I also saw a question in terms of the recording. It does take us a little time to, you know, edit and post the recordings sometimes. But if you go to our website, that takes you to where our YouTube page is, and you can get to all of the webinar recordings. Oh, Andrea beat me to it and put my information in the chat. So thanks, Andrea, if anyone wants to grab it. So anybody else want to raise their hand, ask a quick question before we log off? We've probably got some Sacramento and
question. Sí, yo.
Yeah. So, okay, go ahead. We have a couple questions.
Mi nombre es Talia.
Hi, my name is Talia, and look, my daughter, well, I have 4 children, 3 boys and 1 girl. All 3 were diagnosed with severe hemophilia B, the 3 boys, and my daughter was diagnosed as a carrier. However, she has had multiple nosebleeds. In fact, I get called by the school almost every day to tell me that my girl is bleeding from her nose. She has low iron count.
Okay, hold on. Carlos, I did not hear the translation of that. Are you able to switch over and?
Can you hear me now?
Oh, shoot. Okay.
Del estudio.
Yeah.
Okay, can you hear me now?
Just a second, I'm sorry.
Can you hear me now?
Technical difficulties. I thought I had English translation turned on, but I don't think I did because I didn't hear Carlos's translation.
Can you hear me now? Can you hear me now?
Disculpa, ¿vuelvo a repetir?
I'm sorry, should I do it again?
Ashley, did you hear the question?
Ashley, did you hear the question?
Yes, I think the question was that her daughter is having excessive symptoms, especially nosebleeds every day at school. And she's wondering how to get the treaters to maybe believe her so that she could move on to testing and some appropriate treatment. Did that sound right, Carlos?
Así es. Quiero saber qué nombre de qué estudio.
Yes, what I'd like to know is what kind of tests I should request for my daughter.
So
What's
she'd
the
like
name
to
of
know-
it?
She'd like to know what the name of the tests are. Oh, you heard that, Lynn?
Está bueno, no,
No.
Oh, okay.
más o
It
menos.
sounds like this person may
No muy
need
bueno.
specific attention from the council.
Oh,
Yeah, so let's do this. Andrea, why don't you go ahead and put your contact information in the chat. So Andrea works on our team at the Hemophilia Council, and she is bilingual. So she can get on the phone with you and get a little bit more specific information about your situation, and we can see how we can help you get to someone who will be able to hopefully assist you better. Because I in terms of what
Perfecto, muchas
specific-
gracias.
That would be perfect, thank you. And if you can send me all that information all to my email. This is all very important to me. Thank you.
You're welcome. And so I think there was a second question also. I don't know if we got to that one. Was there another question that someone wanted to ask?
Yes, I have a question really quickly. So I have 2 boys with hemophilia A severe, and I've been bleeding as I age. I had my kids when I was 19. I'm 42 now. As I'm aging, I've noticed that I'm bleeding more. When I had my first child, I'm sorry, my last child at 27, I was bleeding a lot. Anytime I get dental work or anything like that, OBGYN procedures, it's just excessive bleeding. I decided to go get checked out. They did factor levels, they did all that, and everything came back normal. But I mean, even my own dentist was concerned because he thought he hit a nerve or something, because I wasn't healing. It took about 8 weeks or so for me to heal. So this is becoming a concern to me. And I went to go see 2 different hematologists, and they said my factor levels are normal. I'm getting ready to go and get a second opinion. I decided to put that aside and and decided to just go and get a second opinion. I mean, my life matters, so I need to go see what's going on. Has anybody else experienced anything like that?
I think that is not an uncommon story. Unfortunately, I mean, I've heard variations on it. I think that one of the things, and I mean, Ashley had noted that they think that perhaps people with normal factor levels can also bleed. I don't know that exactly is the way that I would phrase it, but there is definitely evidence that suggests that the genotype of that you carry, so like what your mutation is that's causing, you know, whether it's hemophilia A, B, VWD, etc., is more tied to the amount, like how a person bleeds, than potentially what the factor level is. And so that's very preliminary information. It's something that they haven't been able to study nearly as extensively as they need to. But I think that, you know, I think one of the ways that I've heard it phrased in the past is it's like we should treat the bleeding, not so much the level, right? So the treatment should be based on how much is the person bleeding, how much is it impacting their life, and what can we do to deal with the root causes of these symptoms, as opposed to being so caught up in, oh, well, it's all based upon what the person's level is. So again, feel free. There's been a couple of them great points. You know, the lab that is doing the testing needs to have expertise. Sometimes mishandling of the lab work can impact the levels. As been mentioned before, our hormones can affect the levels. So like if you were anxious when you were getting the blood work done, that could raise your level. Depending on where you were in your cycle, that could affect the level. So it's certainly something that, as much as we don't like to get poked, sometimes you need to have the test a few times to really sort of see where you land. And I think some folks have made some similar points about that. So you want to, and hormone replacement therapy could also affect levels. So I think that those are options to, you know, talk to your doctor about. And again, I'll copy and paste my information in the chat. If you want to email me, feel free to email me a little bit more specifics as far as like where you've been seen and that type of thing. And maybe I might be able to make some recommendations of a good place to go try to go for a second opinion.
Thank you so much. Thank you. This is really good information. So I'm really gonna get this started again. So yes, thank you. I just recently went to my doctor's hematologist and I brought it up to their attention and they're like, definitely go get checked out. You know, you just need to go get checked out. So, but thank you.
Yeah.
So I'm gonna start this journey again, and I hope I get some answers. Thank you.
Absolutely. Let us know how we can help.
Thank you so much.
All right. Well, thank you everyone for joining us tonight. Please feel free again to use the email or the phone number to reach out to us if we can assist you. And really appreciate those of you that shared their stories. I guess there was another question that had come into chat, like as far as when the best time is to check your level, I think is what they're maybe asking. And to be honest, I can't speak to that I'm not a physician, so I'm not exactly sure about what that is. So that's where I would encourage you to make sure that you're working with a hematologist that has expertise in this. And I think that question was originally asked in Spanish. So feel free to reach out to Andrea with any more follow-up questions so that we can help you get connected to the right folks. So that can assist you. So thank you again, everyone, for joining us. Hope you have a great evening. And as others have said, we really wish you all the best to those that are still on their diagnosis journey. And we will do our best to help you along that pathway. So thank you for coming tonight. Good night, everyone.